Hi everyone, it's Dr. Jesse Chai, your friendly neighborhood dentist from Bradford Family Dentistry with your weekly update. So we are gearing up at Bradford Family Dentistry for our grand reopening. So as you know, we actually did not close down during the COVID pandemic. We were open to help people with their emergencies. So other than that Easter long weekend, we were here Monday to Thursday helping as many people as we could, to get them out of pain. And during those times we were not seeing emergencies, we were working on things to improve the office. Now personally, I've been watching a lot of videos, a lot of webinars on like clinical things, on things that we got to do to get ready for reopening, what's going to change with this virus and what we had to do differently. So we've been up to date, making sure that we're on top of things to make sure that, when we go back, we're going to have the safest environment possible. So as well, we've been busy documenting all our systems because, a lot of the systems we didn't actually have documented. So it was just, there's some inconsistencies and things. So we want to make sure that when we're training new people or even with the team that we got now, that we're going to be able to deliver consistent service. So we've been working on that, making sure that's there. We've been reaching out to patients just to say hello and check in. So you should have got a call in the last 2 months from us just to say, just check in with you to see how you're doing. So as you know, I've been shooting these videos for the last month or so, just also so you know that we're here for you, trying to give you some positivity, some tips that you can do during this time. So we've been really keeping busy. We're getting ready for this grand reopening from the COVID. The only thing is we just don't know what date that is yet. We know it's coming, and we know it's got. We're going to get there at some point in time. So we're just getting ready now. I know our colleagues in the United States, some of them are already opening up their offices. Our colleagues in other provinces in Canada are also starting to open up their offices. So Ontario is starting to talk about reopening strategies as well in general. So we know that it's coming, so we're getting ready. So my gut tells me by the beginning of June, we'll probably be open for all non-emergency care. So, but I could be wrong. It could be earlier. It may be a little bit later, but it's coming. And so we want to make sure you are protected. As you know, I mentioned this earlier on when this COVID happened. We got 2 giant air purification systems in our office that cleans the air in our office, killing out the viruses and bacteria. And we had that pre-COVID. And so we stepped that up a bit. So we've ordered a bunch of other filtration systems for each room, and so we're going to have the cleanest air anywhere. So that's coming. We have enough masks and gloves to make sure. We've always been well stocked in that. The dental office has always been one of the most clean and sterile environments to begin with. So that's always top notch. So that doesn't change. That's going to be consistent. You're going to see us wearing these face shields now when we're doing our treatment, to protect, the team members and myself from the aerosols, and so we don't pass it on to other people as well. So you're going to be seeing us wearing those. We've also installed some new contraptions to suck up the water in your mouth when you're getting your cleaning, so a lot more efficient than the little straw thing. It's going to do a lot better job at making sure that none of the aerosol gets in the air and this gets sucked up right away. So we are also still offering in-car check-ins. So when so you don't have to wait in the waiting room if you don't want to. You just call us when you arrive, and if the room's ready, we'll get you back right in there. If it's not ready, we'll just give you a call back when it is ready, and we'll just bring you straight to the room. So we're pre-screening. So on the phone calls, we're going to pre-screen you to make sure you don't have any symptoms before you come in. So make sure, to keep everyone safe, if you have any symptoms, you've traveled outside of Canada, you've been around people that have tested positive for COVID, obviously it makes sense to just stay home. And we're going to be asking you those questions, and just for common courtesy for everyone, okay? And so we're going to take all the precautions to make sure you're safe, okay? So listen, I've been working all this time. My team has been working all this time with helping people with emergencies. I've had asthma since I was 5 years old, so getting the COVID would be a really, really bad thing for me, and I don't want my team to get it either. So we're making sure that you're protected. We don't want to risk our families getting sick, and we certainly do not want to put you at risk either. So we got you covered, right? So That being said, if you've been dying to get your teeth cleaned, because I know a lot of people they say my teeth are starting to get fuzzy. I can feel the fuzz on my teeth now. I can see it building up. If you've been waiting to get in to get your teeth cleaned, and that needs to be addressed, or you were supposed to come in March or April, May before COVID had started, and you're overdue for a cleaning or any treatment, whatever that may be, you should call now to make sure that we can get you in for June when we reopen. All right. The schedule is already getting full, as we already had patients pre-scheduled in June for those that already had appointments there, and those that were proactive when COVID happened, they've already scheduled themselves for June. So if you want to make sure you get in when this pandemic, the state of emergency is over, you want to give us a call. All right. So we're here Monday to Thursdays. So just give us a call so we can get you taken care of. Now we will be calling out people, but you got to keep in mind. We got to, from the list that they gathered when we made the hello calls to see how you guys are doing, there's a list of over 600 patients that want us to give us a call or give them a call when the pandemic's been lifted. So there's a lot of demand to come in to get your teeth cleaned or treatment done. So if you want to be near the top of the list, you should give us a call so we can get you pre-scheduled for that, okay? And we want to try to accommodate as many people as possible. So here's the thing. If you have an appointment in June, please give us a call to confirm that you are good to go with that appointment, and so that we don't give your appointment time to someone else, because if we can't reach you, we're going to have to at some point in time assume you're not coming, and we're going to put someone else in there. So if you can, please give us a call to confirm that, hey, yes, I'm going to make that appointment. I want that appointment. Put me down as a strong confirmation. We will make sure that your appointment is reserved for you. Okay. So so we want to try to accommodate as many of you as possible. So just make sure that if you want to be in June, try to give us a call sooner than later. Okay. So I know now more than ever, we have to focus on our health. And as your dentist, I know you cannot be healthy unless your mouth is healthy, right? So if your mouth is not healthy, you're not healthy. It's a proven fact. So, the bacteria in your mouth has been linked to an increased risk in heart disease, stroke, certain cancers like colon rectal cancer, pancreatic cancer, and I was surprised to see it actually has been shown in some studies to increase the risk of breast cancer. It's been directly linked to the cause of Alzheimer's now. It increases the risk of liver disease, kidney disease, increases the risk of pneumonia. For people that are pregnant, increases the risk of complications, right? Preterm, low-weight babies. The rheumatoid arthritis is also affected by gum disease. So here's the thing. In this, from a study that was done in the States, almost 50% of the population of adults over an adult range in the States have some form of active gum disease, meaning that the gum is infecting the gums and the bone of the teeth. 50%, and over 70% have some form of gum disease. So the statistic tends to run into Canada as well. So, those are crazy statistics. So we want to make sure that you have the healthiest mouth so you can fight the disease, okay? The bacteria in your mouth has been linked to increased risk of chronic disease. It also has been linked to and shown to decrease your immune system, because if you think about it, if you got an infection in your mouth and your body's diverting all the white blood cells there to fight it off, you're going to be prone to other problems. You're going to be prone to other diseases, bacterial infections, like viral infections, including this COVID thing, okay? So we want to make sure you have the healthiest mouth possible, okay? So if you currently have, bleeding gums, you see in your mouth they're red, they're angry, you got bad breath going on there, it hurts to chew somewhere, you got some swelling going on, you got an infection in your mouth, okay? So we got to get you in, take care of that as soon as possible. So if you need a cleaning, give us a call so we can get you in June. So that kind of is my tip of the day. Be proactive about your oral health, because it's going to pay dividends in your overall health. So I'm Dr. Jesse Chai. That is your weekly update for this week. Again, I'm Dr. Jesse Chow, your friendly neighborhood dentist from Bradford Family Dentistry. Until next time.